Okay, so I was supposed to start at 8, but when I came back from college early, so I felt motivated to sit now only. So why not? It will be like a good study session, I believe. Today, so I want to plan well and then immediately sit to study. So I'll plan properly now for the next 3-4 days at least. Today we had a research presentation, went very well. Uh, just want to make sure I accomplish as much today. Hello, Trikan. Hello, Anaya. Hello, Arnav. Hello, Ash. Yes, early. I felt motivated to sit early. So I was like, hi, Gitika. Okay, everyone put your goals, please. Let's keep each other accountable. I shaved also. And I was always first coming. Yeah, I know. I'm so like proud of his. Always he's very punctual and immediately he comes. Subha also first to comment always. अरे ऐसे if you study तो then 12th में तो आराम से you will do so well in NEET. Thank you, Draken. I just shaved and I cut myself while shaving. So then it was like bleeding a bit. Then it's fine now. Like it was just it went over like a pimple by mistake. I got too many pimples now. I got to reduce body heat. I think I should like put off those 3 lights. Those cause a lot of SA in your face. How was your day? It was great. Today was very good in college. Also, I was very productive. Also, we had a research presentation that went well. How was you guys' day? Uh, okay. I will make a schedule. I have no plan for today, tomorrow, nothing. So now I'll just sit to plan properly. You also should plan. Break time. Uh, 6. So I wanted to put a poll. Like, should I put that like that rain music, like PG in the background? I wanted to. Hi, Srishti. And like people like add like text now, like here, like today is like day 4, or like and put text on top. I don't know. I haven't figured all that out. But should I do that? I have never really seen that yet, like how to do that. But I'm sure it's not that hard. Text and like which day study with me kind of thing. So I'll just create. Just let me know in the poll. I also want to know. Like there are a few comments also saying he do it. I was like, okay. But I don't know if it's mine is going okay so far. My what happened? All good. Put rain music, okay. I think this should work today. No. His reactions is very fickle. Half the times it works, sometimes it doesn't. Okay. So let's start with a laser sharp focus. Hi Advai. So then this should work now. If that is working, then this should also work. Done. It's working. And let's put some positivity. Let's Today I'll sit for a while. I think today I'm very motivated to study. Positivity. The school effect is very cool. Chalo, let's go. Now I'm planning. And I keep putting those polls, like now that post kind of thing, like which I put today about highlighters, because there, I want to give a lot of information, but I don't know how to give information yet. We haven't been able to make too many videos. Although I could actually, if I, spare an hour a day, definitely can make videos. Wow, 23 people. Thank you for joining. Yes, we'll put more posts. Paka, paka. As in whenever like if I'm traveling or like if I'm if I break between classes, I can just put one on like thing I use. I have so many systems which I use. I just wanna keep telling. I try to tell in lives also, but then it doesn't reach as many people. So I'll put it through posts so you can always go through it. Today also, like after my seminar only I posted that. Like I was just sitting in the room. So then I was like, let's put a post. Because I was reading something and then I realized, oh, I'm highlighting, let's just put a post. Right. So today 7th March, it's currently 4:45. Say we plan till 4:50. From 4:50, I really have to do adrenal cortex and neurophysiology. My god, I have to do so much neurophysiology. I've studied for 10 plus hours. Wow, Aryan, so proud. Very good. Keep going. IIT Delhi is there. The dream is there and you will achieve it. Let's go. Uh, okay. I have no clue how I should go about. Okay, I have a journal submission also. Okay. I should open the schedule also. I have a biochem. Thank you. So glad, Aryan. सो उसके लिए क्या बोला था आई थिंक रेस्पिरेटरी सिस्टम है ठीक है वो हो गया ओ गॉड आई स्टार्ट डूइंग एलिमेंट्री एलिमेंट्री है ही नहीं मेल रिप्रोडक्टिव सिस्टम अरे यार ठीक है वैसे भी कभी तो सबमिट करना ही होगा यूरिनरी सिस्टम भी नहीं ओ मेल रिप्रो इज दैट ठीक है दैट्स फायर डायग्राम like reconnect this also. Okay, chalo, let's plan now. Sorry, bus again. Now let's focus, let's sit and let's plan properly. 4:50 to iPad, I need my iPad. It has my full schedule for the month and the next month. I want to put a video out in the next 2-3 days. I'll definitely try. So, going to schedule. So today is 7th March. I have a physio exam on 11th, literally 11th. PSM visit and all. Okay. RS skill certification. Okay, I'll write my backlogs. Firstly, my physio journal is incomplete. When I get bored, I'll do that from yesterday. I have to take the sign also from Amol. So if incomplete, take the sign. So physio journal करना है. Then I have to do micronat journal around कितने diagrams थे? Around 8 to 10 diagrams are left. ठीक है, micronat journal. This is just a backlog list of what I want to do. And currently, I have to do. Then I have to micronat journal. Then I have to do this. Apna nucleotide. I haven't touched that chapter. I feel very guilty. Nucleotide metabolism. It's such an important chapter. I've only done the introduction, and so many lectures have been done. I have to keep up. Get better at keeping up with the portion. Right, nucleotide we have to keep up. Then I have to do physio 11th k portion, that is neurophysiology. I haven't touched that chapter again, not good. Neurophysiology, fine. What else? बायोकेम में क्या चल रहा है? प्रोटीन मेटाबॉलिज्म चल रहा है. So I'll just write anat physio बायोकेम. अनैट में एब्डो के बहुत लेक्चर सीरीज मेरे बाकी है देखने के लिए. Abdomen physiology I have to do. Female reproductive system is going on, I'm not fully there. Renal I've caught up. CVS I've caught up. That is a good thing, I've caught up actually. Biochem में nucleotide will be first priority, then followed by fatty acid. I'm catching up, I won't leave that. Nucleotide I'll cover. Nucleotide cover करना पड़ेगा. Protein I have to cover. एनाटमी एब्डोमेन प्लस बैकलॉग्स अभी देख लेंगे. एम्ब्रियोलॉजी मेरा बहुत बाकी है, बहुत मतलब बहुत. एनाट सीसीटी आई हैव टू प्रिपेयर वेरी प्रॉपर्ली. माइक्रो एनाट स्टडीज आई एम नॉट डन. फिजियोलॉजी में रिप्रोडक्शन द टेस्ट इज कमिंग ऑफ कोर्स. द जर्नल लास्ट टाइम का क्रेनियल नर्व्स वाला, दैट वाज pretty difficult. I want to shoot a video also how to do it. I remember better. Cranial nerves, nucleotide, anat. ठीक है. So I'll start with first adrenal cortex. It's currently 450. It's not 450. What am I saying? Oh, it's 5-7. Oh, this clock is पीछे. ठीक है. It's 5. ठीक है. 5 to 6 I should finish, I think, adrenal cortex. 5 to 6 adrenal. Then we'll do adrenal medulla. Then I want to read Vishram Singh today of anat. पढ़ू क्या? नहीं, बायोकेम शुरू करते हैं. और कल क्या है? कल what are so many things you have to check. What is that tomorrow? I should revise tomorrow का portion and go also. WhatsApp पे खोलना. WhatsApp web. ठीक है, बस just go ahead. ज़्यादा प्लानिंग में टाइम कर मत. Go and start. Yeah, I often do this. Like I just keep just thinking what I'll do. I'll plan this, do that. So planning में 1 घंटा जाता है. Rather just take the first thing and start. That's the best solution sometimes. The most important thing at hand, first thing. Let's go. Okay, adrenal system. कब से चल रहा है यार? I have to refinish this now. I'll definitely finish. Let's go. Abnormalities of adrenal cortex. Hypoadrenalism is adrenal insufficiency or Addison's disease. Inability of adrenal cortex to produce insufficient adrenocortical hormones. Features of the adrenal cortical disease have been provided. Is the most frequently caused by primary atrophy or injury of the adrenal cortices. Primary atrophy or injury of adrenal cortices in 80% is caused by autoimmunity against the cortex. It can be caused by tuberculous destruction of the adrenal glands. Invasion of adrenal cortices by cancer is another cause. Invasion by cancer is another cause of Addison's disease. So if it's invaded by cancer, then it's taken. In some cases, adrenal insufficiency secondary to impaired function of pituitary gland. Adrenal insufficiency which fails to produce sufficient ACTH. When ACTH output is too low cortisol and adrenal production decreases, and eventually the adrenal glands may atrophy because of lack of ACTH stimulation. So they'll cause its atrophy because of lack of ACTH. Secondary and renal insufficiency is much more common than Addison's disease. Secondary insufficiency is much more common. Secondary insufficiency is much more Adrenal insufficiency is much more common than the Addison's disease. Adrenal insufficiency, secondary adrenal is much more common than the Addison's disease. ठीक है. Adrenal insufficiency is much more common. Insufficiency is much more common. So secondary adrenal is much more common than Addison's disease, which is called primary adrenal insufficiency. Adrenal is also called primary Addison's insufficiency. Damn. Disturbances in severe adrenal insufficiency are described in the following section: mineralocorticoid deficiency. Mineralocorticoid deficiency. Mineralocorticoid means lack of aldosterone secretion greatly decreases renal tubular reabsorption and consequently allows sodium ions, chloride ions, and water to be lost in the urine in great profusion. So primary adrenal insufficiency and secondary adrenal insufficiency. Secondary is more common than primary, and so secondary is more common than primary, and primary is only called Addison's disease. Primary is only called Addison's disease. Now, disturbances in the adrenal insufficiency described in the following sections: mineralocorticoid deficiency. So lack of aldosterone secretion greatly decreases renal tubular sodium absorption, reabsorption, consequently allows sodium ions, chloride ions, and water to be lost in the urine in great profusion. ठीक है. Secretion. Lack of aldosterone secretion. Oh. Cortisol reduces the mobilization of proteins. Lack of cortisol will reduce the mobilization of protein and fat. ठीक है. Melanin pigmentation. Fine. Melanin pigmentation. Characteristic of people are presence of melanin pigmentation of the mucous membrane and skin. Lips, pulse, thin skin areas. Melanin pigmentation होगा in Addison's disease. Melanin pigmentation is seen in Addison's disease. Melanin pigmentation is seen in Addison's disease. And cortisol secretion is depressed. With what? Stimulate the formation of melanin by melanocytes in the same way that MSH does. So basically, it's causing melanocytes to be secreted. Melanin pigmentation of the skin membranes and mucus, lips, and the skin of the nipples. Okay, treatment of people with Addison's disease. In a few days, guys, in a few days. The poll is such a close. Oh, it's 50-50 now. Wow. Now 105 votes. Now I'm confused. It's 50-50. I thought like there would be like a definitive response. Okay, excess ACTH is the most common cause of Cushing syndrome. It's characterized by high plasma levels of ACTH and cortisol. Primary overproduction of cortisol by adrenal glands accounts for 20 to 25% of clinical cases of Cushing syndrome and is usually associated with reduced ACTH levels due to cortisol feedback of ACTH secretion by anterior pituitary gland. Reduced ACTH levels due to cortisol feedback of ACTH secretion by anterior pituitary gland. So in Cushing जब low levels of ACTH क्योंकि already ये high hyper secretion of cortical dexamethasone. Dexamethasone is a synthetic glucocorticoid. Dexamethasone is a synthetic glucocorticoid. Can help distinguish between ACTH dependent and ACTH independent Cushing syndrome. Can help differentiate. Dexamethasone can help differentiate and distinguish between ACTH dependent and ACTH independent Cushing syndrome. ACTH dependent and ACTH independent. That is dexamethasone. This test is called the dexamethasone test and is usually considered to be the first step in the differential diagnosis of Cushing syndrome. So it's called dexamethasone test, and it's used to test between the ACTH dependent and ACTH independent cortisol. It's ACTH dependent and ACTH independent Cushing syndrome. Cushing syndrome can also occur when large amounts of glucocorticoids are administered over prolonged periods of time for therapeutic purposes. Patients with chronic inflammation associated with disease such as rheumatoid arthritis. Chronic inflammation, rheumatoid arthritis. Chronic inflammation, मतलब rheumatoid arthritis are treated with glucocorticoids. Okay. A special characteristic of Cushing syndrome is the mobilization of fat from the lower part of the body with concomitant extra fat deposition of fat in the thoracic and upper abdominal region, giving a bundle of buffalo torso. Oh हाँ, buffalo torso is seen in Cushing syndrome. Buffalo torso is seen in Cushing syndrome. Buffalo torso, fine. Buffalo torso is seen in Cushing syndrome. Buffalo torso. Keep something. Cushing syndrome, buffalo torso. Chronic inflammation associated with rheumatoid arthritis. That's chronic inflammation associated with rheumatoid arthritis. Chronic inflammation associated with rheumatoid arthritis. I don't know, today I've not been that efficient. I've been studying, but not so productively. Probably when you're just come back from college, you're not that productive. But I'm not even tired. Like I'm like pretty normal, but still okay. I think I will still. I don't know. Should I take a power nap? I'm thinking. I say I'm not being like very productive. ठीक. I'll study. I can do it. श्रुतं श्रुतवतां परिहासधामा तद्भक्तिरेव मुखरी कृते ब्लाह्मणां यत्कोकिलकिलमधुरं विरौति तच्चानुचारुकलिकानि करे कहेतु. Focus. ठीक. A special characteristic of Cushing syndrome is the mobilization of fat from the lower part of the body you're mobilizing fat from lower part of the body, losing the fat from the lower part of the body with concomitant extra fat deposition in the thoracic, mobilizing fat from the lower part of the body with concomitant extra deposition of fat in the thoracic and upper abdominal region given as buffalo torso. Buffalo torso seen in Cushing syndrome. Buffalo torso Cushing. Buffalo torso Cushing. The excess secretion of chylus also leads to an edematous appearance of the face. Edematous appearance of the face. And androgenic potency of some of the hormones sometimes causes acne and hirsutism. Hirsutism means excess growth of facial hair. Hirsutism, excess growth of facial hair. Hirsutism. And acne. Acne and excess growth of facial hair. Excess growth of facial hair, that's called hirsutism. And acne. Acne and excess growth of facial hair. The appearance of face is completely described as a moon face. So you have moon face, you have a buffalo torso, moon face, buffalo torso, and hirsutism and acne. Acne, hirsutism. Acne is seen, hirsutism is seen, buffalo face is seen, and buffalo torso and moon face. In Cushing syndrome, in untreated patients, over 80% of patients have hypertension, presumably because of the mineralocorticoid effects of cortisol. Okay. Mineralocorticoid effect of cortisol भी है, minute है but है, तो उसकी वजह से you have hypertension also. Now effects of Cushing syndrome on the metabolism and of carbohydrate and protein. The abundance of cortisol again the Cushing syndrome increase the body as high as 200 mg per day of meals. To enhance gluconeogenesis and decrease glucose utilization by the cells. Protein carbohydrate often performed in Cushing syndrome greatly decreased, causing greatly decreased tissue proteins almost everywhere in the body with the exception of the liver. Except liver. So Cushing में क्या क्या होता है? Let's write all the cases of Cushing. Firstly, Cushing's में you have acne, hirsutism, moon face. Acne, hirsutism, moon face, buffalo torso. Increased blood glucose, decreased protein in full body except the liver. So you have acne, hirsutism, moon face, buffalo, decreased protein. The loss of protein from the muscles in particular causes severe weakness. The loss of protein synthesis in the lymphoid tissue leads to suppressed immune system. Lymphoid में कम हुआ तो immune system भी कम होगा. Immune system भी कम होगा, ये भी कम होगा. Correct. So what will happen? Protein कम हुआ, weakness ज़्यादा हुआ, more weakness, And then also be decreased immunity. There'll be more weakness because of muscle proteins gone decrease. Thus, these patients are highly susceptible to infection. Even the protein collagen fibers in the subcutaneous tissue are diminished so that the subcutaneous tissues tear easily. Protein collagen fibers in subcutaneous tissue are diminished so that the subcutaneous tissues tear easily, resulting in development of large purplish striae where they are torn apart. So the subcutaneous tissue will tear easily. The subcutaneous tissue will tear easily. Subcutaneous tissue tearing easily will expose the under part, which is causing large purplish striae, large purplish striae, where they are torn apart. You get large purplish striae, large purplish striae. So striae are seen in the what? Cushing syndrome. Cushing syndrome striae because of the protein collagens are going. The protein collagens are going, and they are causing this to be removed. Protein collagen causing the subcutaneous tissues to be removed. In addition, severely diminished protein deposition in the bones. There is diminished protein deposition in the bones, causing severe osteoporosis with weakness of the bones. So you have osteoporosis because of प्रोटीन अगेन बोन में भी प्रोटीन कम है सो सब जगह प्रोटीन बहुत कम होता है डिक्रीज प्रोटीन विल कॉज सिवियर ऑस्टियोपोरोसिस एंड वीकनिंग ऑफ द बोन्स osteoporosis of the bones is reduced protein in the things will cause osteoporosis. Fine. Now, treatment of urinary Cushing's. Treatment of urinary Cushing's concept of removing an adrenal tumor in if this is the case of decrease if this is the case or decreasing the secretion of ACTH. So you are either removing the tumor or you are decreasing the secretion of ACTH. ACTH का secretion. Hypertrophied pituitary glands or even small tumors in the pituitary that over-secrete ACTH can be surgically removed or destroyed by radiation. Drugs that block steroidogenesis such as metirapone, ketoconazole, and aminoglutamide. That metirapone, ketoconazole, metirapone, and aminoglutamide. So we have aminoglutamide, ketoconazole, and ketoconazole, and yeah, glutathamide, ketoconazole. I forgot. What? Glutathamide, ketoconazole, and metirapone, ketoconazole, and aminoglutathamide that inhibit ACTH secretion. So these are blocking steroidogenesis or they inhibit ACTH secretion only. So these are what blocks steroidogenesis. Metirapone. Okay, ये सब फार्मैक में करना ही है बट स्टेरॉइडोजेनेसिस मेटिरापोन aminoglutathamide and ketoconazole. They are inhibiting ACTH secretion such as serotonin antagonist and gamma aminobutyric acid transaminase inhibitors. So what inhibits ACTH is gamma aminobutyric transaminase inhibitors or serotonin antagonist. Can also be used when surgery is not feasible. So this is done when surgery is not feasible. ACTH is inhibited. ACTH inhibited by gamma aminobutyric acid (GABA) transaminase inhibitors. Gamma aminobutyric acid. Gamma aminobutyric acid (GABA) gamma transaminase inhibitors, and serotonin antagonists and gamma aminobutyric acid transaminase inhibitors gamma aminobutyric acid transaminase inhibitors. Fine. Gamma aminobutyric acid transaminase inhibitors. gamma amino butyric acid. Gamma amino butyric acid. ठीक. Treatment of people with Cushing syndrome. Primary aldosterone is called Conn's syndrome. Really? I didn't know this. Right then, right then, right then. But it's learning. But this chapter just does not want to get over. And then you have adrenal medulla, adrenal cortex, adrenal medulla, and diabetes mellitus. Diabetes mellitus, adrenal cortex, adrenal medulla. Fine. Charge my. Gamma amino butyric acid transaminase inhibitor, which is a what inhibitor? It prevents ACTH secretion, and steroidogenesis is by meterapone. Steroidogenesis stoppage is by meterapone. Oh God, meterapone, amino glutathione, glutathamine, amino. I don't know. अरे यार, this is so volatile. Amino glutathamide and ketoconazole. Ketoconazole, amino glutathamide, ketoconazole, and meterapone. Serotonin antagonists such as gamma aminobutyric acid, GABA transaminase. GABA transaminase, gamma aminobutyric acid. Fine. It's 546. ठीक है. Aminobutyric acid. I'll take a power nap till 6. And 6 was the break, so we'll discuss at 6. Because I'm also a bit not tired really, but I'm not being that productive anyway. So I'll take a power nap. It's always good. I think I'll be more fresh and more productive post that. So for 5 7 minutes, I'll take a power nap. We'll be back. We'll meet at 6. Hello. It's exactly 6 back. Still, the poll is very, I say, non-definitive. Put rain music. Okay. Everything is good. By the end of the week, you get more stressed with Sunday test. Okay, it's okay, but don't take stress about it. It doesn't matter that way. Just take each Sunday test as a way of you studying for that chapter. Be grateful that you are able to study that chapter because of the Sunday test. Don't take stress of it. Ultimately, only the final exam matters. So give every test as like a fun thing only. Also, do share your streaming schedule and posts. I think that'll get too much. I feel that'll be too many notifications. That I don't want to keep because usually see 4:30 तो रोज है ही और शाम को then like वैसे भी the notification आएगा ही and even that's not fixed for me also. That's what now. So morning is तो always fixed and शाम का is not fixed. So वैसे भी even I'm not sure. Oh, it recognized this. This will be like an ulta negative. This will let's put a celebration for a good break. No, it's not working. I can manually do it now. But luckily, there's an option. Uh, I've studied for 10 plus hours. Yes, very good. Yeah, I started early today. I was going to start at 8 because I was like, I'll sleep, but I was not that tired today. Hello. Hello, New Year. Hi, Kenna. Kenna Pancha. Okay. Yeah, आज आपका कॉलेज नहीं था. No, I था आज कॉलेज था but I just got over early so I started. आप इतना हार्ड वर्क करने का ताकत कहाँ से पाते हो? I don't know, just inherently have मेरे में. I want to do something like when I decide something I really want to do it. So हो जाता है. आप बहुत hard work करो. Yes, definitely. I love working hard. It's ultimately everything. If you want to achieve something, hard work is a must. What time do you go to sleep? 9:30. Hello. Hello, Samyajit. First time, welcome. I sleep 7 hours. Hello, Ram. Yes, Aryan, of course, I remember. Today was so productive only because of you. I couldn't attend the live but played recording of live session. Oh my god, that's so cool. Thank you. I'm glad. Great job, Rocky. Make a post. Hello. Chalo. Anything more you want to discuss? You want to ask something? Otherwise, then I'll continue again. What is your key to consistency? Just manifesting, strong mindset. Yes, I remember you are. I'm also waking up at 4:30. Good. That's a good time. Great time to wake up, genuinely. Yeah, I'm lacking. Is this your hostel? No, it's my house. Lacking planning today. KM. Should I just refer to notes for physics and start practicing, or should I watch lectures first? I feel I'll waste a lot of time. Like revising is more important. However, whatever works for you. If you learn better by lecture, but lecture ultimately your own revision matters more. Now constant watching of 20, huge progress. Thank you. Don't call me sir, yeah, please. You guys need not call me bhaiya also. You can just call me Sanmay, that's fine. Sir to mat bola, please. Sir is too much. Yes. Do attempt tests. Adrenal cortex, adrenal medulla, adrenal cortex, adrenal medulla. adrenal cortex and medulla, and we will finish endocrine system fully. I think I'll start with nucleotide also today. And tomorrow's schedule also, let's see. I don't know what's that tomorrow. Keep forgetting to check the next day's schedule. Today I'm in a more like laid back mode. I don't wanna like go too fast, but I have to have an exam in 3 days. Hi Dev. Oh yeah, from Haryana, nice. Good to know. What's your age? 19. Okay. Sure. I'll continue now. We'll take the next break. Oh, you tried power nap, very effective. Good to hear. Power naps are the best, trust me, genuinely. Okay, we'll break at 8 p.m. now. I didn't do anything for CET actually. I just gave it essay, like with my NEET preparation. I didn't do anything. On the morning of CET, I read thoda like the morning, like when I was going to the exam hall on the way, I read thoda GSB, like the Maharashtra State book for like 20 minutes. But that's because I'd highlighted a few stuff. But that's about it. Wow, again the poll is that with 181 votes, we are at exact 50-49. 51-49. Hello, MS. You just came. Any tip to reduce screen time? That day I said no. Like there are a lot of systems you can keep. I'll make a video on this. I should note down whatever I should make a video. Okay, I'll note down my diary on the last page. One is reducing screen time. Or like at least I'll put a post or something. Tell me now what all I should make on. I have to make on chemistry also, like how to effectively do chemistry. I have it ready. How to effectively do physics, chemistry, bio. Then I don't want to keep doing like compared to exam compare. I want to talk more general things also. So I'll make very less videos, but make high quality videos. I don't want to make like excessive videos of NEET or stuff like that. I'll keep it more productivity, positivity oriented. So one is for consistency, reducing screen time. One is for physics, uh, chemistry, physics, bio. Okay, you want for consistency, then I will also like I don't know when I'll make this. A lot of people are saying timetable banana. How do you make like an effective timetable? So timetable is one. So one would be manifestations. That's one thing I definitely love. LMR notes making, हाँ वही. Chapter wise guidance. Okay, that it now I don't I'll go more overall, but definitely chapter wise maybe second year I want to teach me LMR, so like short notes, how to make an effective LMR. Correct. And one on mental health for sure. That should be the first video actually. Yeah, in my timetable I used to always have a to-do list also. It was a to-do list plus a minute-to-minute timetable. Uh, One tab tricks and tricks. Do you journal? No. I want to though. Like sometimes in my timetable only has to write reflections, but I don't journal per se. But I want to actually. It's a very healthy habit to like journal, have a diary. I have a diary, but I don't really write like oh what all happened today. But I actually should. It's a very nice record actually. It's something I wanted to do but never implemented actually. One for consistency, yeah. Screen time consistency, LMR notes making. ठीक है. A lot of other systems generally, systems that can be done. How to do effective revision. And that's LMR only basically. ठीक है चलो, we'll meet at 8 p.m. Now you know I want to focus now. Let's go. I haven't been that productive, but it's been a great day. Let's not break the consistency. Do you take MBBS notes? I take in class nowadays more, but I've not been able to make chapter wise notes yet. I'm trying, not been able to make it yet. ठीक है चल चल bye. Let's get back to studies now. Yeah, I get time. There's always time, but I just haven't like included it in my schedule yet. There's always time for sure. There's always time. Yes. Okay, chal sir. I'll keep my mic on only. Okay, let's continue. Metalphone. If ACTH secretion cannot be easily decreased, the only satisfactory treatment is usually bilateral, partial, or even total adrenalectomy. Bilateral, partial, or total adrenalectomy if ACTH secretion is not decreased. If it cannot be decreased, the ACTH बहुत बड़ा है. It follows by addition of adrenal steroids to make up for inflammation. Now, primary aldosteronism, that is called Conn's syndrome. Primary aldosteroidism, aldosterone, no, aldosteronism, occasionally a small tumor of zona glomerulosa, aldosterone causes a large increase of aldosterone, resulting in primary aldosteronism or Conn's syndrome. Although in a few syndromes, hyperplastic adrenal cortices secrete aldosterone rather than cortisol. Adrenal cortices secrete aldosterone rather than cortisol. The effects of this excess aldosterone are discussed in the detail earlier in the chapter. The most important effects are hyperkalemia, mild metabolic alkalosis, slight increase in ECF volume and blood volume, and a modest increase in plasma sodium concentration, and almost always hypertension. So, we have what are the most important effects of hypokalemia? This small tumor, मतलब hypokalemia का alkalosis होगा, ट्यूमर alkalosis, K प्लस कम होगा, alkalosis होगा. Okay, why will there be hypokalemia? Because probably aldosterone, it will cause potassium to go out. So aldosterone bada, so more K plus is excreted, which causes hypokalemia, and it will cause metabolic alkalosis. Probably more sodium, more alkalosis, more ECF volume, sodium concentration, and almost always hypertension, of course. There'll be hypertension, there'll be K plus excreted, so there's hyperkalemia, there's more sodium, there's alkalosis, there's ECF volume increasing, and there is something called hypertension, of course. Especially increasing persons with primary aldosteronism. Aldosteronism are occasional periods of muscle paralysis caused by hypokalemia. Hypokalemia causes muscle paralysis. The paralysis caused by depressing effect of low ECF or potassium concentration on the action potential transmission. An action potential transmission by nerve fibers is explained. One of the diagnostic criteria of primary aldosteronism is a decreased plasma renin concentration. Decreased plasma renin is basically primary aldosteronism. Primary aldosteronism may decreased plasma renin concentration. Diagnostic criteria for primary aldosteronism. Primary aldosterone कब होता है? Primary aldosterone will occur when there is decreased plasma renin concentration. Decreased plasma renin concentration. So there's more reabsorption, right? Diagnostic criteria is a decreased plasma renin concentration. Decreased plasma renin concentration. Fine. So you have a decreased plasma renin. The decrease results from feedback suppression or renin secretion caused by excess aldosterone or the excess ECF volume, fluid, and arterial pressure resulting from aldosteronism. Feedback suppression. So, primary aldosteronism. Primary aldosteron. Primary aldosteronism. Steronism. Aldosteronism. Aldosteronism. ठीक है. Primary aldosteronism. Aldosteronism. ठीक है. One of the diagnostic criteria of primary aldosteronism is the decreased plasma renin concentration. You have a decrease in plasma renin concentration. This decrease results from the feedback suppression of renin secretion caused by the excess aldosterone or by excess ECF fluid volume and arterial pressure resulting from aldosteronism. Treatment of primary aldosteronism may include surgical removal of the tumor of or most of the adrenal tissue when the hyperplasia is the cause. Another option for treatment is the pharmacological antagonism of the MR with spironolactol or eplerenone. Spironolactol or eplerenone. Eplerenone. These are difficult pharmacological drugs. Spironolactone or eplerenone. ठीक है. Now adrenogenital syndrome and adrenogenital syndrome. Adrenogenital. Occasionally, an adrenocortical tumor secretes excessive quantities of androgen that cause intense masculinization effects. Okay, adrenogenital, correct. They will cause more androgen secretion, which will cause intense masculinization. If this phenomenon occurs in a female, but virile characteristics. Oh, virilism, adrenal virilism. Yeah. Including growth of the beard in the female, a much deeper voice means low pitched voice hoga. Occasionally baldness if she has a genetic trait for baldness. So genetic trait for baldness, growth of the beard, much deeper voice, growth of beard, baldness, deeper voice, adrenal virilism. ठीक है. Beard होगा, deeper voice होगा, baldness होगा. If she has a genetic trait for baldness, masculine distribution of the hair on the body, and pubis, growth of clitoris to resemble a penis. ठीक है. Deposition of proteins in the skin, and especially in the muscles that give typical masculine characteristics. Deposition of proteins in the skin. So skin में there will be proteins. Skin will have proteins, especially in the muscles, to give a typical masculine characteristics. Baldness, growth of the beard, much deeper voice. This is adrenogenital syndrome in a 4-year-old boy. In the prepubertal male, a releasing adrenal tumor causes the same characteristics as in a female, plus rapid development of male sex organs. In the prepubertal male, puberty के पहले male, which depicts a 4-year-old boy with, my god, adrenogenital syndrome. In the adult male, the releasing characteristics of adrenogenital syndrome are usually obscured by the normal releasing characteristics of the testosterone secreted by testes. It is often difficult to make a diagnosis of adrenogenital syndrome. Difficult to make a diagnosis of adrenogenital syndrome in the adult male because it's very similar to the testosterone secreted by the testes. In adrenogenital syndrome, the excretion of 17 ketosteroids, which are derived from androgens in the urine, may be 10 to 15 times normal. My god. So, if there's adrenogenital syndrome, you'll have 17 ketosteroids. Is it like 17 adreno 17 ketosteroids. 17 ketosteroids are also excreted. So in adrenogenital syndrome, you have 17 ketosteroids. 17 ketosteroids. Take it. 17 ketosteroids. Hmm. 17 ketosteroids are derived from androgens. 17 ketosteroids are derived from androgens. 17 ketosteroids. 17 ketosteroids are derived from androgens in the urine, maybe 10 to 15 times normal. This is used in the diagnosing the disease. 10 to 15 times the normal. 10 to 15 times the normal. 17 ketosteroids in adrenogenital syndrome. Now we have something called congenital adrenal hyperplasia. Congenital adrenal hyperplasia is called CAH, congenital adrenal hyperplasia. It's a group of inherited disorders which manifest with adrenal insufficiency. Adrenal insufficiency are caused due to autosomal recessive mutations of genes that encode the enzymes. Autosomal recessive mutation of genes that encode the enzymes responsible for the biosynthesis of corticosteroid hormones. Wait, I have to open the door. Okay, let's continue. Congenital adrenal hyperplasia is adrenal insufficiency. They are caused by autosomal recessive mutation that encode the enzymes responsible for the biosynthesis of corticosteroid hormones. Hmm. Okay. Due to the impaired biosynthesis of corticosteroid cortisol in the adrenal cortex, several androgenic substances accumulate in the adrenal gland. Androgenic substances are accumulating. The most common congenital adrenal hyperplasia is due to the deficiency of enzyme 21 hydroxylase. Enzyme is 21 hydroxylase. This type of CAH, that is congenital adrenal hyperplasia, can be classified into two groups. It is with salt wasting and with sample virilization, that is non salt wasting. वे क्या है ये सब? Salt wasting and ठीक है, it's okay. Salt wasting and non-salt wasting, that is called simple virilization. CAH with salt wasting and CAH with simple virilization, that is non-salt wasting. Clinical features. Congenital adrenal hyperplasia. Congenital adrenal hyperplasia. Congenital adrenal hyperplasia. उसमें you have what all we have? In that we have adrenal insufficiency because the enzymes responsible for the corticosteroid synthesis उनमें कुछ तो the gene का mutation हुआ है because of autosomal recessive disorder and वो gene का mutation की वजह से the cortisol is not produced only, that's why several androgenic substances are accumulating and enzyme 21 hydroxylase की deficiency है and that is the most common cause, enzyme 21 hydroxylase. This type of CAH is grouped into salt wasting and non-salt wasting. Let's see what that means. Non-salt means simple virilization. Salt wasting, in this condition in which classic 21 hydroxylase deficiency, the manifestation of the disease severe due to classical मतलब insufficient CAH. ठीक है, insufficient congenital adrenal hyperplasia. उसमें से what is the what is the simple wasting में the manifestation is severe due to insufficient aldosterone production. Sodium retention by the body is not enough. Insufficient aldosterone production, sodium retention is not enough. तो अल्डोस्टेरोन ही नहीं बन रहा है तो सोडियम रिटेंशन ही नहीं हो रहा है. हाँ, makes sense. And it is lost in the urine. These children, if undiagnosed, can rapidly progress to dehydration, leading to fatality. So, undiagnosed children can go into fatality if undiagnosed in the children. Damn. They include poor feeding. मतलब अभी अल्डोस्टेरोन नहीं है, पुअर फीडिंग होगा, डायरिया होगा, वॉमिटिंग होगा. पुअर फीडिंग, डायरिया, वॉमिटिंग और एग्जाम्पल देखो भी ऑफ कोर्स डिहाइड्रेशन तो होगा ही. अल्डोस्टेरोन नहीं है तो हैज टू बी डिहाइड्रेशन. लो ब्लड प्रेशर, अरिथमिया, hypoglycemia, metabolic acidosis and shock. Metabolic acidosis, shock, excuse me, metabolic acidosis, arrhythmias, hypoglycemia, low blood pressure, dehydration, feeding, diarrhea, vomiting. Feeding, diarrhea, vomiting, low blood pressure, arrhythmia, hypoglycemia, arrhythmia and hypoglycemia, and shock. Hypoglycemia, shock, hypoglycemia, shock, hypoglycemia. There's hypoglycemia, there can be shock, there can be metabolic acidosis. Let's think why. Aldosterone. Oh, acidosis होगा. Probably because the sodium is not being reabsorbed. The sodium का alkalinity won't contribute. Uh, so this is called salt wasting. मतलब salt waste हो रहा है, मतलब sodium बाहर जा रहा है basically. CAH with salt wasting could also manifest with low cortisol and increased androgens. In such patients, the symptoms are clinical features of ambiguous external genitalia in female newborns, enlarged genitalia in male newborns. Virilization features that occur very early in age, at 2 to 3 years. Virilization features include appearance of hair in the armpits and pubic regions, armpit and pubic, armpit and pubic regions. Facial hair ज़्यादा है, so more armpit, pubic, facial, acne, enlarged genitalia, deep voice, muscle development in children who grow older, and finally into adults. Other features could present as menstrual irregularities or failure in the females, early appearance of beard in males, and infertility in both males and females. Infertility in both the males and the females. Infertility can be seen in both males and the females. Okay. So there's infertility in male and female. Fine. Infertility in males and females. Infertility in the males and females. CAH with simple virilization, that is non-salt wasting. The type of CAH is a less severe form of classic 21 hydroxylase deficiency. The aldosterone deficiency is moderate and not life-threatening as seen in the salt-wasting CAH. However, very similar to the salt-wasting CAH, cortisol is deficient and androgens accumulate leading to adrenal cortical function tests. There are several tests that can be used to evaluate the function of adrenal cortex. My God, my God. I have like 10 tests given. Adrenal cortex functional test. Functional test. Typical hormonal deficiency may not be apparent with routine hormonal assay tests. Therefore, stimulation tests are used to measure secretory capacities, and sometimes suppression tests are used to evaluate hypersecretion of the adrenal cortex. The different tests listed below are given. ACTH stimulation test, ACTH simulation test, and then there's a case scenario. God, this chapter is just not getting over. Adrenal cortex function tests. भैया भाई यूट्यूब खोलता हो तो तू पढ़ता दिख जाता है। अब रिग्रेट होता है। अरे तू मत रिग्रेट मोलेक, तू रिग्रेट करेगा तो क्या होगा भाई। भाई आपका डिस्क्रिप्शन देखो, बोलना था कि कितना पढ़ोगे बस करो तुम। हम कहाँ जाएंगे? आई डोंट अंडरस्टैंड, नहीं समझा ही नहीं। ACTH stimulation test, also known as the cosintropin or the tetracosaccharin or synacthin test. The N-terminal 24 amino acid sequence of ACTH is synacthin is a similar for cortisol secretion. The two protocols, 1 hour, 1 hour short, 1 hour short synacthin test and multiple day ACTH stimulation test. That is long synacthin test. So I'm just seeing the headings. This is too much. ACTH stimulation test, CRH, ACTH stimulation, and you check record upon releasing hormone, insulin, induced hypoglycemia stimulation test, metaropyrone stimulation test, which is a steroidogenesis blocker. Steroidogenesis blocker is metyrapone. Then dexamethasone. वही है ना, I guess. I forgot what it does. Mineralocorticoid suppression test, adrenal androgen stimulation test, adrenal androgen suppression test, mineralocorticoid suppression test, dexamethasone suppression test. Okay, dexamethasone suppression test, that is dexamethasone. ठीक है, dexamethasone suppression test, dexamethasone suppression test. Fine. Dexamethasone suppression test, ACTH, adrenal cortex, listed below. ACTH stimulation test is also known as the cosintropin or tetracosaccharin, the N-terminal 24 amino acid sequence of ACTH. Oh. Long. Okay, so the group present in ACTH is called synacthin, which is also called cosintropin or tetracosaccharin. Tetracosaccharin, or that is synacthin. Tetracosaccharin or cosintropin. Tetracosaccharin or cosintropin. Tetracosaccharin or cosintropin, a 20 N-terminal amino acid sequence of ACTH. Synacthin is a powerful similar for cortisol secretion. The two protocols could be done: 1 hour short synacthin test and multiple day ACTH stimulation test, long synacthin test. Patient with adrenal cortex damage or destruction will not show increase in serum cortisol secretion to ACTH administration. ACTH administration. Patient with adrenal cortex damage or destruction will not show increased ACTH, will not show ACTH secretion, not show increased ACTH secretion, will not show increased ACTH secretion. ठीक है. Okay, I'm getting थोड़ा saturated with this. बस हो गया अभी के लिए. I will now do something else, maybe biochem. Should clean my specs also, probably that is also one. Okay, it's not very clear. Today's very ऐसे I don't feel ऐसे too motivated to do something. ठीक है, it's okay. I don't have to be always too harsh on myself. Today's like an mood. I'm not as fully driven, but it's okay. It's better than not doing anything. It's always better to do something. Something is better than nothing, even if it's just 1% of what I can do. Not obviously not. Maybe like 40%, 50%, but that's still very good actually. It's always better to do something than do nothing. I'm very lost. I have to do biochem now. Nucleotide metabolism. Yes, this is the topic. It's actually that not that big of a book. This is nucleotide molecular biology. Not bad. I think I read a few pages if I'm not wrong. But like very less, like 2 pages or something. One page. 2 pages. And it is a total of how many pages? From 617 all the way till it's going to be a lot. 100 pages basically. I usually do not eat unhealthy, but I feel like eating doodh biscuit. It's actually hmm, 240 votes. Okay, at a 53% yes. I'll have to see how to do it. But then quite a few people have said no also. Like, and probably there must be a strong reason for no. Otherwise, it would have got like a significant yes. Okay, chal. Parle-G OG, yes. No, it's very unhealthy, but ठीक है चलता है कभी कभार. Like once in a while. I just want some quick sugar. Okay, adenine, sugar, ribose, nucleoside, adenosine. Uridine. Hypo xanthine में D-ribose is inosine. Hypoxanthine with ribose is inosine. adenosine, D-adenosine. Oh, it's already Friday. Saturday, Sunday is back. D-adenosine purine nucleotides. Adenosine, adenosine, adenosine. Yes, Vaishnavi, I had, yes, it was coffee time. अरे सर मत बोला यार प्लीज. You can call me Sanna only, that's also fine. सर तो नहीं प्लीज. Hello Shyam. Okay, I think I'll do thoda purine. Then probably I'll switch back to physio. Hard time divide the topics, how exactly to go about things. But it's okay, you don't always have to. I don't know what we have tomorrow, though. I want to check that. Yeah, I'll just my camera will just go off for 2 seconds. I need to check my phone. So, so tomorrow in biochemistry, I have protein metabolism. Okay, I have protein metabolism. Protein metabolism. Right. So I have protein metabolism to do. Tomorrow I have then in physio I'll just check. Physio भी usually डालता है schedule. नहीं MBBS daily schedule. Sorry for the marks. ठीक. It's March 7, March 8th. I नहीं है. Great. Okay. Nucleotide protein metabolism. Protein metabolism also I don't know much. Yeah, how do I manage? Neurophysio भी करना है. I have to finish also before endocrine pancreas, homeostasis, glucose. ठीक है, one thing at a time. Let's divide. वो तो काम है. Then divide the topic out. 7th. So today, make small targets. I don't think I'll be able to achieve much today, and that's okay. I'll just do what is most important. Abhi what my physio exam is coming up, so I better get started with neurophysio. So at least some part of neurophysio I'll start today. And since we have protein metabolism, I should read and go protein metabolism जितना भी हुआ है. Neurophysio करना चाहिए, protein metabolism. That's enough for today. Now tomorrow just I have to take my physiology journal. So complete physio journal tomorrow. Then whatever sir teaches protein, do it in class itself. Mm, well, no, tomorrow I can't keep such high targets. Then again, neurophysio only tomorrow. I'm done with CVS. I will do neurophysio. I'm done with RS. Endocrine B, it is on the end stage. So neurophysio plus some endocrine. I think I'll have to do only physio tomorrow. Class में also I'll read physio only. ठीक है. So now till 11th, I think I'll keep my target physio only. So by 9th, I think I should complete neurophysiology and complete endocrine also if something is left. And start revision from VD Joshi. So I'll start revision from, or just start revision from, I don't know, Gaitan or VD Joshi, any of them. But basically, I'll start with RS. I haven't done RS in a while because I have to revise RS. And after RS, then probably mm, CVS start revising again. God, 10th will be definitely a huge marathon. I have to do a lot of CVS. 10th will be pura neuro physio revision. Neuro physio, no, I won't revise now. I'll revise CVS RS and endocrine revision. 10th full day will go for revision. Revision of all the topics, respiratory system, everything that's left. I want to finish before 11th, everything properly. So, okay, for the next 3 days, I'll only do physiology. A bit, stretching it a bit, but I think works. And 11 March, then we go ham on the rest of the topics, anatomy and all. Then we'll go ham on biochem, that is nucleotide metabolism, protein metabolism. Fatty acid, I'm doing on spot only with ma'am. Anatomy, I have to keep up with abdomen. Still not been able to keep up effectively. Nucleotide, protein, abdomen. Okay, now mind is clear. Only physio basically. And थोड़ा आज maybe biochem हो सका तो. And then should I just take a break and like go to play table tennis or something? That also works. I think that is more feasible and more practical. I need a break also sometimes. ठीक है, I think I'll do thoda. Then I'll stop. I think I'm tired. Protein metabolism, neurophysiology. Okay, protein, neurophysio, and then uh, endocrine, CVS, RS, and then repeat. Endocrine, CVS, RS, 10th ko, 11th ko also morning mein, whatever time I have, endocrine, CVS, RS. Hopefully do decently in the test. And then go full force on the ANAT test on 26th. And then my final first term internal is coming in April, which is not that far. It's just a month and a half away. Second intern. Fine. Okay. It was important to plan. So we made a decent plan for the next 2 weeks. And definitely my iPad also. Okay, I think I'll sleep for a bit. I think I'll stop for today. I feel I'm tired also, and I don't want to stretch. It's been good 3 days have been very good. Generally, they've been very productive. So, if I want to discuss anything, just if you want to ask something, I'll just read the previous chats till then, and then we'll stop for today. We'll meet at 4:30 again. I think I'll sleep more today. Like, probably I'll just go to sleep. I'm very tired. To finish biochem. Also, I have to go out for like a dinner function at a family friend's house. So I'll go also. Hi, Gagna. Yeah, I don't. Oh, I'm not caught a cold, but I don't know. My voice is thoda. Like I'm sneezing. I should rest early today. I won't stretch it. I don't want to stretch. Just go through the chat. I got 355. How to get 360? अरे भाई same ही है. It doesn't matter. Just work on your consistency. But good that you're getting 355. MS. सॉल्व किए हुए एमसीक्यूज के भी टेस्ट में 360 नहीं आया मतलब तूने ठीक से सॉल्व नहीं किया ओके सार तेरा कितना हुआ 75% एंड एनाटॉमी पूरा बाकी है वैसे एनाटॉमी हो जाएगा मेरे को वैसे भी आता है बस मॉर्फो में कॉन्फिडेंस नहीं है Morpho. अरे आई मेड दिस लाइक ब्यूटीफुल चार्ट फॉर मॉर्फो तुझे चाहिए क्या I'll find it if I have it I don't know like it had like all the examples or something I wish I'd collated all my information properly back then. Like I have everything, but I don't know where. Morpho. Okay. Morpho मुझे भी करना है. Seniors, any tips on how to master ionic equilibrium? Ionic equilibrium के लिए just read, do it properly. You have to just keep revising. NCRT ढंग से पढ़ लो and after you just keep reading it again. The chemistry NCRT beautifully explains itself. You'll feel confident after you read a few times. Just do everything NCRT ka properly. I feel you'll be able to manage. I feel no one can be 100% prep when it comes to morpho. True. Eventually you will get confidence, I guess. It takes time. It takes time. Do the families part properly. अच्छा बोला अर्नव लिबरिस हमारा कौन से family में है? I don't know. Except for the examples, they're easy. It's not in the book. Old witch course. तो बायो के लिए 100 बुक्स रेफर करता है तुझे भी नहीं पता All the best. Yes. I'm finding it. I don't know where I have it. I just compiled all the list of the oh god bending. It was just like the examples I just compiled. I'll see if I find it. I'll send. आप इतना हार्डवर्क करने की ताकत कहाँ से पाते हो? I don't know यार inherently कुछ तो ऐसे करना है मतलब I always want to achieve something. That is my biggest drive. Like you can say make your parents proud or achieve something. Hello, Anshika. We are so close to 900. Really? We're closing in like last. I think in the evening it was like 860 or something. Let's check. We're close to 900. Oh damn, we're 896. That's really cool. 896 is crazy. आप मोबाइल कितने hours यूज करते हो? By the way, I'm NEET aspirant. Good, good. I don't know. I don't use it that much. Just WhatsApp. Baki not really anything else. Like my questions for physics. I'll take a break of 10 minutes now. Okay. Which test series should I purchase? I don't know if are you in a coaching or not? I don't know for JEE Advanced which one to do. मत भेजो मेहनत करने दो हमें. Space. How to stay away. No one, like, ultimately it's up to you now whether you want to take negativity or not. No one can, you know, like bring toxicity in your life. It's your decision if you want to take toxicity. Like anyone can do anything. It's ultimately up to you what you take. Like if someone calls you something, it doesn't mean you're that thing now. Like only if you believe that you're that thing, if they say it, then you will get affected by it. But if you don't get affected only by it, then it doesn't matter. So that's one thing. Shut off all negativity, shut off all toxicity in your life. Bring only positive things, things that make you joy. Like keep saying, like I always take screenshots of like positive comments or like comments which praise. Then I like seeing that. Then I keep reading them again and again. So then it gives me like a good. It makes me feel better about myself also. So constantly make things to get more positivity in your life. And I'm always like talking to myself like gratitude, telling things that I enjoy, like or saying that I'm grateful for this or I'm grateful for that. So just keep having gratitude, keep enjoying, celebrating the positives, and ignore the negatives which can be ignored, which you may not have a solution to or you need not address in the first place, which are not relevant basically. Do you have Telegram? Yeah, I have it, but I haven't done really like everyone wanted LMR, isliye I made it. Like if you all want, I'll try, but I don't want to commit yet. Like I have really lot of exams coming up, but it's there. Someone just put in the chat now, please. Telegram. It's in the description. It's in my description if you find it. It's like in the older description. Which test series should I purchase? I don't know. Yeah, JEE Advanced के लिए which test series? मैं आज कॉलेज से आकर ही पढ़ने बैठ गए. हाँ. Yes. I don't know. I used to give JE mocks for NEET revision. So I used a website called examgoal.com. I really liked the way they had given it and everything. I really liked that website. So for PYQs of JE and all, I really liked examgoal.com. And you had to pay like 60 or 90 bucks and then you got access to all the JE papers. So I really liked that website. Exam Goal. One of my friends had recommended it to me. He was also giving JE. He did really well in CT, so now he's in VGTI. Do you have Telegram? You want, I'll put the Telegram link. I've just put one LMR, like how to do an LMR usme. So you all can also use whoever's giving NEET. When 6 months are left for NEET, I would recommend you start giving JPYQs on examgoal.com. I found that app really good for like solving JPYQs. It's a really good app, and like the solutions also pretty accurate, pretty good. And for doubts, I really liked like PW Solutions करके YouTube पे channel है. Like you just put any question on YouTube or on Google, you'll get the PW Solutions का answers, and they're always right. Even DoubtNut is usually always right. Vedantu ka solutions are always really good. But I really loved PW Solutions, and there were like thousands of sums ka answers. That channel has like some 4 lakh videos or something. Imagine 4 lakh videos from one channel. Like Alak sir, how much is that? So that PW solution has almost every possible MCQ, like physics chem का MCQ का सब answers है उसमें. So I really preferred using that physics वाला का solutions, PW solutions. ठीक है then चलो. I think we will stop. I also have to go out and then I'll sleep early today. We'll meet at 4:30 then. Chalo, bye. So it's slow थोड़ा सा maintain. Yeah, good. Hi guys. See you at 4:30. Shucks. I don't know, I think my screen is glitching. It's lagging. Yeah, cool. I'll just end. Bye.